Sponsored by St. Elizabeth Healthcare.
All right, thanks, Erica. Well, the FDA has just approved a new blood test, and it can be used following a head injury.
But local doctors have a word of caution about using it to measure concussions in children. Medical reporter Liz Bonus joins us now with what experts want all of us to know. Liz.
Hey guys, good afternoon once again. The sports medicine team at St. Elizabeth Healthcare told me that they recently attended a conference where the approval of this blood test by the Food and Drug Administration was discussed. They say it is approved for use in adults, and here is what experts want us to know about it.
So there are two proteins that the test measures, UCHL1 and GFAP, which are proteins that are released from the brain and into the bloodstream when there's a significant brain injury.
Dr. James Hahn told me today that this new test, a blood test which could be taken after a head injury, measures what's called biomarkers in the blood, is not what he says he would recommend following a suspected concussion when a child might be sitting on the sidelines.
This is absolutely not a concussion test. It is more of a brain bleed test. So the test cannot rule out or rule in concussion. What it does is a better job of determining whether we need a CAT scan in an emergency setting for a more significant brain injury like a brain bleed.
Dr. Hahn and Dr. Mike Miller are part of a sports medicine team which cares for patients where they perform. We met up with them at the Griffin Elite Training Center.
A lot of prevention-oriented stuff going on here.
Dr. Miller points out that with other injuries, he can often see the symptoms. Ron Winkler, for example, has
There's some lower back pain, and I think it's just gradually affected me over time.
But when it comes to concussions,
You can't see a concussion.
so Dr. Miller says while tests that measure biomarkers in the blood, such as these proteins, may be helpful in the future,
We're not there yet, but I think that the concept of having a blood test to help us with a diagnosis or help us track progress, I think that's real. I believe in my heart someday we're going to have some form of a blood test that helps us, but we're not there yet.
The old adage of when in doubt, sit them out still applies. So if there's any concern for a concussion, the best thing that you can do is pull them from the competition and have them evaluated by someone that specializes in concussion diagnosis and management.
so we have these for heart disease. Now you know how they can test your enzymes, and we'll say you
yeah.
had a heart attack. That's the idea behind this. Their word of caution is that it would take a few hours or take some time to get the information back.
Okay.
And so it's not the only test you would want to measure for a concussion, which
Okay.
often things get touted as, oh, you can just take the blood test and find out if you're fine. And they said there's so many other things. They do eye tests. They do recall tests. They have you go through different physical tests to see what's happening. Concussions are a very complex thing.
They are.
Probably will never be one catch-all, but we're working on it, which is a good thing.
I have a question for you. So earlier you said don't wake up a child in the middle of the night if they've had a concussion. What about an adult?
Don't wake up anybody.
Just don't wake up.
That was
I'm having so much trouble believing
It's
this because
counter
you're-
to everything
Yes.
we've been taught all along.
It was the second part. An emergency person was the first one to tell me that. He goes, we don't tell that to people anymore.
Right.
And I was like, really? And so then I started digging. Sports medicine people don't. Yeah, it's really
Right.
interesting what we
Things
learn.
change.
That's what I love about this field. That's why I'll always be employed.
That's right, yeah.
In
Always
terms of
something to
job
talk about.
security,
And it gets
yeah.
better in your field.
Yeah, no, I know it's true. Like we see that with eye disease and
Yes.
sports medicine injuries, that kind of